As I mentioned earlier, I had the great privilege of really coming into this space 5 years ago, working with the Coalition for DSP Living Wage. And we were charged with all the providers and parents and staff came together really with the focus on raising awareness of what a direct support professional is. There was great misunderstanding within the legislature, and there had been a real lack of investment in wages. So we all came together and focused on that. And in that, got a great understanding of who these individuals are and how critically important they are. They are the heart and soul of the community-based system. They're delivering the care that enable individuals to thrive and reach their goals. So it's sort of fitting, and I'm excited that really one of my first events in this role as CEO is we have an event on September 19th where we celebrate the DSPs. Of course, the first week in September, first full week in September is DSP Appreciation Week. But I would say certainly it always has been, but will continue under my leadership, DSPs and policies and that are focused on investing in DSPs will always be the number one priority. They are the individuals that know the individuals we serve better than anyone. They're the ones with connectivity can read when perhaps an individual is off a bit. But that can only happen with continuity of care, which is why it's critically important that we invest in DSPs so they have the own money for them to thrive in their own lives and can support their own families. I applaud the legislature and the administration for investing in DSP wages, but that needs to continue. We also should be looking at more workforce development around DSPs, career pathways. This is something that I'm hoping to do in a greater way in this role. I think when people are invested and can see the growth in their career, that it will give them the passion to continue to serve. And we want DSPs to stay in these roles. One of the neatest things that I had earlier, one of my first visits was I went to a day program and I met with the director. And she started with the agency about 25, 30 years before as a DSP. And because she was so connected to the individuals, she created this day program. She really was the designer. You could see how proud she was that she could see individuals thriving in a space that she created. And that was only possible because of her longevity in this career. And that's what we want. I've been really moved by many of the DSPs and how long they've been in this space. But one of the biggest challenges is certainly the turnover and how that impacts care. We need to minimize that. And the way that we do that is by continued investment in wages, continued investment in the individuals, enabling them to grow, and create pathways where if they want to develop more as a DSP, we need to invest and provide those opportunities. Or also if they want to move from a DSP through the behavioral health the workforce all the way through to supervisor roles, leadership positions, we need to provide those opportunities because the entire behavioral workforce, needs to be strengthened in New Jersey, and it is critically important to the continuity of care of these individuals.